Welcome. I'm Rear Admiral Paul Reed, Director of the Office of Disease Prevention and Health Promotion. Today we'll be launching the first in a new quarterly video series that will complement our Health and Wellbeing Matter blog. In the coming months, we'll invite partners from across the federal landscape to join us for a discussion on the work of advancing health and well-being for all people. Now, this past November, the federal government released the Federal Plan for Equitable Long-Term Recovery and Resilience. And this groundbreaking plan lays out a whole-of-government approach to strengthening individual and community resilience and improving well-being nationwide. The plan was developed and is led by an interagency work group currently composed, rather unprecedentedly, of senior career staff from over 45 federal departments and agencies with a common vision to address the deep disparities in health, well-being, and economic opportunity that have been laid bare through the COVID-19 pandemic, and to do so by transforming the way the government seeks more meaningful outcomes of our efforts on behalf of the American people. Now, the findings that drove this plan make clear that everyone has a role to play in the nation's recovery, in enhancing our individual and collective resilience, and in improving our nation's overall health and well-being. And today, I'm thrilled to be joined by Dr. Maria Rosario Jackson, Chair of the National Endowment for the Arts, for a discussion on the work her agency is doing, leveraging the Plan for Equitable Long-Term Recovery and Resilience, and her vision and commitment to building belonging and community connections as a means of ensuring lasting resilience in our communities. Dr. Jackson, welcome.
Thank you so much for having me, Admiral Reed.
It's my pleasure. Let's begin with something that I've heard you talk about in relation to well-being, especially in the context of the intersection of health, community vitality, and democracy. And that's the idea, the concept of artful lives. Can you tell us something about that?
Sure. So the idea of artful lives, it's an inclusive concept, and it includes everything from our everyday experiences and aesthetic choices we make around food, fashion, how we care for ourselves, how we care for our families, everything from that to participation in the arts through more conventional ways of thinking about the arts at concert halls, museums, etc. So it is that broad spectrum that includes all of these ways of participating, not only as audience or as consumer, but also making, doing, teaching.
So if we stick with that for a moment, perhaps you can share a bit more about how Artful Lives continues to help realize the value from other sectors, other segments of our communities, and enhance that value.
I think if you take that inclusive concept, which contains all of these different ways of engaging individually and collectively, and you think about the power of experiencing art either as a creator or as someone who is witnessing it, if you think about how we engage head, heart, and hand, intellectually, emotionally, and physically through the arts, it's such an important way of being whole, of really bringing forth your full humanity. And there's something about that way of being that has impact in all sectors. So I often think that unleashing the power of the art requires us to think about not only the art sector, but our intersection with other sectors like health, like community development, like so many of the sectors that we rely on to be a nation of opportunity. The arts are integral to that.
Well said. You've previously stated, and I'm going to quote you here, so I'm going to read from this paper, that the ability to be expressive, tell and see your stories, that is, in individuals or communities, on your own terms, are critical to a just and civil society. Can you elaborate on that more, on the importance of this, and particularly in terms of expanding opportunity and the role that the arts play?
Sure. You know, for many years, as someone trained in urban planning, I would often be asked by colleagues, if you care about equity, well-being, healthy neighborhoods, why are you doing this arts and culture stuff? Yep. And it took a while for me to be able to articulate what I knew in my gut and what, you know, later in my career was affirmed through research and other ways of knowing. And I'll say this, that if you look around the world and throughout the ages in strategies to disempower the first thing that is tinkered with is one's ability to make sense of the world, to ask questions, to have dominion over your own narrative. And these are the things that we do through art, you know, the ability to tell our stories, to imagine, to express. And I keep thinking, if it's so important that it's something that has to be diminished or controlled when one is oppressing, then why don't we think of it as critical and central, integral to building healthy communities?
Yeah, regrettably. In a similar vein, crises like the pandemic disrupt many facets of our everyday lives, including how we prioritize those things that are fundamental to our health, well-being, and our resilience. From your perspective, what's the role of arts and culture in times of crisis? And how do individuals and communities benefit from those cultural and artful lives?
Yeah, there are many ways, I think, in which the arts play a critical role in our ability to survive something like a pandemic. And some of those ways have to do with our personal well-being, and some of them have to do with our ability to show up as part of a collective and care for each other. But if you think about how the arts help us make sense of the world, that's important during a time when everything is turned upside down. The arts help us find different ways of thinking, feeling, and being. They're a source of inspiration and innovation. I think the arts help us see the humanity in others and allow us to connect and understand our commonalities as well as our meaningful differences. And I think that all of that is necessary to survive through something like what we've been through over the past few years. You know, the ability to reframe, to retool, to repair. Yeah. These are some of the things that are made possible with the arts.
It's inspiring to think of how that might help us in the months and weeks to come, and years. Yeah.
Yes.
The federal plan for equitable long-term recovery and resilience, it's intended to be a whole of government and arguably a whole of society plan towards enhancing individual and community resilience. And many of the discussions centered around this involve the concept of shared stewardship. And I'm going to read a definition specifically for shared stewardship. The concept is defined as the deliberate and meaningful collaboration, investment, and understanding of the interconnectedness of communities, governments, the private sector, and other organizations that impact people to equitably achieve and sustain greater resilience for all. Can you tell us a little bit more about how the NEA approaches the idea of shared stewardship in particular, and discuss the ways that other various government agencies might take advantage of the NEA and incorporate the arts into initiatives that they hold that are aimed towards helping individuals and communities through times of crisis?
Sure. The thought that we are collective stewards, let's say, of hopefully places that are healthy where all of us can thrive, I think it requires us showing up, as I said earlier, head, heart, and hand, fully committed to our well-being and the well-being of our neighbors. And I think that if we understand the role of the arts in helping us to show up that way, then thinking of the structures and the mechanisms that we rely on to care for each other, what I think of as our civic infrastructure. I like to think of an arts-infused civic infrastructure, right? So there's a civic infrastructure that is about those relationships and mechanisms that allow us to care for each other. And they are made stronger and more impactful because we can show up in this way that allows us to be creative and imaginative and allows us to see connection and meaningful difference. Allows us, I think, to get unstuck. And I think that integration of arts, culture, design into how we think about the systems that we rely on to care for each other It's so important. And I think we'll be stuck if we don't figure out how to weave that in.
I like that. I particularly like an arts-infused civic infrastructure. The image of that is, that too is inspiring. So where do we go from here? What do you see as the next steps that need to be taken, and what are the opportunities for the NEA in particular, and particularly focused around advancing health and well-being?
Sure. I think one of the things that I'm very excited about in my role as chair is helping others to understand the National Endowment for the Arts as a grant-making organization, which we are and have been. I think also, though, helping us understand the agency or helping others understand the agency as a national resource. So our ability to partner with agencies like Health and Human Services, like Department of Transportation, Housing and Urban Development, and being able to help discern how integration of arts, culture, and design can be impactful and actually allow us to deliver to the American public in a way that is what we aspire to. I think that looking to the National Endowment for the Arts as a partner in helping to devise solutions, to frame issues, and to execute, to deliver and make a difference in people's lives. That's what we're here for.
Terrific. This has been a fabulous conversation.
Thank you.
I really appreciate our time. What NEA has to offer to advance health and well-being and improve resilience in this country, I think everyone needs to hear. And I, for one, am going to continue to advocate for that as well.
Well, thank you so much for having me. I appreciate this time with you.
It's been wonderful. To learn more about the Equitable Long-Term Recovery and Resilience Plan, please visit health.gov. And to learn more about the endowment's work, please visit arts.gov. Thank you.
Produced by the U.S. Department of Health and Human Services.